I think MCG offers the best set of benchmarks in the industry today. One of the beauties of the benchmarks is they're written in the language of the guidelines. And the guidelines themselves is really the currency upon which utilization management is performed. So it's giving actionable information at the level that we're making decisions. That's really very helpful and not something that I can get anywhere else. So for that reason, I find myself referencing the benchmarks weekly throughout the year. I may be the only person here, other than the ones that write them, that know every detail of them. It's helpful.
That's one of those pieces that we are now beginning to slowly integrate, is doing those like the daily progressions and looking at where we are landing as far as inpatient stay lengths versus, the nation or just Texas.
We look at your benchmarks at all our bed day meetings. We do. For all of our bed days and lengths of stay and admissions, and we look at all your benchmarks for that.
And how does that help you?
It just compares us to the rest of the nation, and we are using, I think, moderately managed, and it gives us, it helps us determine what our goals should be and be able to make the goals. Each year we have a goal for our utilization management, and MCG is really a big part of helping us determine what our goals should be.
What we're able to do right now is we take a lot of the claims data and then we do a lot of analytic, so year-over-year costs. You could see from what we did, we decreased the cost of that disease process, year-over-year in each country for some of the top diseases.
We do reference the benchmarks. We have pulled them up on several occasions, and I'm looking forward to using them more in the future. It's usually when our medical management team wants to take a deeper dive as to where we are versus where the national average is, so that we can kind of see what our targets need to be.